everyone. I'm Stephanie with 9 Health, and I'm here with Dr. Tista Ghosh today from the Colorado Department of Public Health and Environment. She's the interim chief medical officer. Before we talk to her a little bit, we're going to talk about vaping today. But I did want to let you know that last week we were talking about lifestyle medicine, and you can find that story on 9healthfair.org and our Facebook page. But today we're here with Dr. Tista Ghosh again with the Colorado Department of Public Health and Environment. She's the interim chief medical officer. Thank you for joining us.
I'm so happy to be here.
And we're talking about an important topic, and you may have heard of it unless you're living under a rock or you aren't working with young kids or teens closely, but vaping and how it affects teen health and our health. So we wanted to bring you in and talk about this issue and first show us what vaping is. We brought some examples. Let's talk about what it is and see what it looks like.
Sure. So vaping is using an electronic device, electronic vape pen, or other electronic device that heats up a liquid and generates a water vapor.
Yeah, and we can take, I have an image for you as well that we can take to kind of show you what these devices look like. And we looked at these little USB cartridge looking things. Those are Juuls. So you may have heard kids talking about juuling, or e-cigarettes would be this other thin one. So you can kind of see those. I don't think I would even know how to use this, put this together, but this is what they are doing. So if kids are talking about that, that's what it is, or if you see that, that's what that device is. And for anyone that has kids or teenagers, these kids and teens and even the adults might think that vaping is a harmless thing, that it's water vapor. Talk to us about that and how that's a myth.
So a big misconception among teens is that they're just using harmless water vapor. It's got nothing in it, it's no big deal, maybe it's flavored water vapor. But a lot of these products have chemicals in them, chemicals that can actually potentially harm you, and almost all of them contain nicotine, which is the addictive substance in tobacco products and regular cigarettes. And one of these little cartridges, so this is a Juul, the most commonly used kind of product for teens, one of these little pods, it looks like a USB port, contains as much nicotine as an entire pack of cigarettes. So,
and how much are teens using when they use, are they taking the whole thing all at once?
So it varies depending on the teen and how often they vape, but some kids use one of these a day, some two. It just depends on how often they're vaping, but this is a pack of cigarettes.
So it's 1 to 2 packs of cigarettes in a young body. Talk about the health effects that has on a teen and youth.
So nicotine can be really harmful to the developing brain. When your brain's developing, nicotine can interrupt your brain cells, and it can really cause impulse control issues, impair your ability to learn. It can cause mood disorders, affect your ability to become addicted later in life. So it's very harmful to the developing brain, and there's really solid research behind the negative impacts of nicotine on the developing brain.
Right. So Colorado Department of Public Health and Environment, they have this website, and it is tobaccofreeco.org, which we have pulled up for you. I will show you. So this website has a ton of resources for parents and others that are working with youth or teens about vaping and what it is. We were talking about this a little bit before we came on. What does a parent do or someone do if they know a teen that is vaping or catch their teen vaping? What's some advice for them?
Well, first, educate yourself and get the facts. Arm yourself with information. Tobaccofreeco.org is a great resource, but there's other resources as well. And know the facts and talk to your teen in a non-judgmental way. Find out if they just tried it once, or if this is something they're actually addicted to. And if they are addicted, get them help. We at the Colorado Department of Public Health and Environment have actually extended the free quit line that's available to Colorado citizens to the age of 12. So parents can call the quit line and try to get teens the help they need. Again, we've extended it to age 12.
Yeah,
so
that's very young. So there's young kids that are doing this.
Yeah. In fact, we have the worst youth vaping rates in the country. We're number 1 in the country for youth vaping. It's not a good number one.
No, that's not a good thing. And the FDA's called it an epidemic nationally, but here in Colorado, even worse.
Even worse. And so this is something we're seeing for kids as young as middle school age, but definitely by the time we hit high school, it's 27, even up to 33% of high school seniors are using vape products. So it's a big deal in Colorado, and something that we want to get on top of, especially because there's a lot of evidence that shows that youth who vape, kids who vape, end up smoking later in life.
Right.
So
Smoking regular cigarettes.
Regular cigarettes, which we know are potentially lethal. So we don't want to rehook an entire generation onto cigarettes when we did such a great job in bringing smoking rates down. And so we don't want to end up with a generation that's like Mad Men.
Right. And we were talking about the age 12, you can call the Colorado quit line for age 12. But these devices, they're not legal to buy till you're 18. So we did have a question from Facebook. How are these kids getting their hands on these? How are they getting them if they can't purchase them till they're 18? I mean, I guess they find a way if they want it. But.
Yeah, I mean, I think they find a way. I think there's also internet sales.
Okay.
So there's a lot of ways that they're clearly getting around the laws, and so we certainly need better enforcement. And then there's the whole internet sales issue that becomes challenging, because how do you enforce internet sales, and how do you know that someone's selling to a minor or not? So.
Right. So, and talk about the things that they are vaping. We talked about nicotine. Is it just the Juul nicotine packs that they're getting? Are they putting other things in vape pens and e-cigarettes?
There are potentially a variety of other chemicals. There can be chemicals that cause things like popcorn lung. There can be flavoring products, which you're supposed to eat, not necessarily inhale. So we don't always know what these chemicals are and what they'll do to your lungs if you inhale them. So there's a lot of unknowns, but it's better to be safe than sorry.
Right, and we talked about them getting teens to regular cigarettes and things like that. I do want to pull up the video that we had, just showing teens and others using vape products, vaping. It blows out a smoke, a water vapor, well, not a water vapor, but a vapor smoke, and it still has chemicals in it. So like this girl sitting next to this guy that's vaping, are you at risk of like secondhand vape? Like when you inhale next to someone, are you still at risk of getting chemicals like that when you're sitting next to someone?
Potentially. I mean, it depends on what's in that particular brand that you're using, but yes, potentially. If you're sitting next to someone and using this, they might be exposed to certain chemicals as well.
Okay, and I did want to also show everyone, so 9 News and GASP have come up with a PSA about secondhand vape smoke, specifically marijuana smoke, but they say smoke is smoke, and that it's all kind of the same. You're getting those chemicals. If I can show it to you, let's see if it'll go. Maybe. All right, it's frozen on us, but I will post that for you later so you can see it. But we also have another question. So they were asking about popcorn lung from vaping. So explain how someone would get popcorn lung from vaping when you're talking about it being a cigarette issue.
There's certain chemicals that cause popcorn lung, and those are in some vape products.
Okay.
So if you used it a lot and you exposed your lungs to those chemicals, that's something that could happen in the long run. Again, it depends on which vape products you're using and if those chemicals are in that product. And there's such a wide variety on the market that we can't consistently say this one has this and this one has that chemical, but why potentially expose yourself to harmful chemicals?
Right, and there's just a lot of stuff out there, and I think really the message is that we're not recommending, no one's recommending that you just try vaping just to see what happens.
Right. And again, nicotine we know is not good for the developing brain.
Right.
So regardless of what you think of the other chemicals, that's definitely something to avoid.
Right. Well, I did want to see if I can pull up anything else on here to see if it is working. Let's see. Okay, so this is that public service announcement that GASP has put out. And again, talking about secondhand marijuana smoke or marijuana vape, and it could be harmful because again, these are chemicals that you're inhaling next to someone, and different chemicals. This one says ammonia, cadmium, all these different things that could be in secondhand vape even.
Right. Now, there's definitely potential to be exposed to a variety of chemicals that you wouldn't normally want to breathe in.
Right. Okay, if there's not any other questions, I did want to bring up another resource for everyone. So Tobacco Free CO and the Colorado Department of Public Health and Environment's website. Those two websites are a great resource for anyone that needs more information on vaping or how to talk to kids about vaping, getting them to stop vaping, or any resources like the Colorado Quit Line if you have a teen that is addicted to vaping, to nicotine specifically in vaping. That's something you can reach out to and get help with. But I also wanted to show everyone we have the Rocky Mountain Hospital for Children is putting on an education tour, and it's next week, and it's interactive discussions, presentations, all about vaping, where you can go and ask questions. It is free. They just ask that you RSVP. There's one Tuesday at the Medical Center of Aurora and one on Wednesday at Rocky Mountain Hospital for Children. Those numbers to RSVP are on your screen, or you can also go to their websites to learn more and to RSVP for those. There are resources out there, and we hope that this somehow helped a little bit, at least shed some light on what vaping is, what it looks like, and how you can get help for your teen. And if there are no other questions, we will end it here. And you can still post questions in the feed, and we will get those answered by Dr. Ghosh. And that is all today. Thank you for joining us.
Thank you for having me.